Before each of my midwife appointments during my pregnancy last year, I'd try to quiet an anxious little voice in the back of my mind. The patient is a 35-year-old woman presenting with her first pregnancy, confirmed by first trimester ultrasound, the voice would tell me. It would go on to recite other relevant facts. I had been feeling particularly nauseated recently, and I was having a hard time sleeping. It was possible those were normal symptoms of pregnancy, the voice would say quite reasonably before leaping to the worst-case scenario. It was possible those were signs I was about to die. The voice was me as a doctor. But instead of being a kind and rational guide during a transformative period of my life, the voice was really stressing me out. Pregnancy was my first real experience as a patient. I'd spent the last 10 years observing our healthcare system as a medical student and now as a primary care physician, but it did little to prepare me for how vulnerable I felt that chilly November day when I went in for an ultrasound to find out my due date. It was the beginning of the first pandemic winter, and my husband waited outside on a street corner, banned from the exam room because of the hospital's COVID-19 visitor policies. He listened to our son's heartbeat for the first time over video chat. Of course I'd been to the doctor here and there before then, but I'm a typical healthcare worker, which means I'm terrible at following my own advice. Rather than having regular checkups with the sort of long-trusted primary care physician I aspired to be for my own patients, I'd ask my colleagues to check my blood pressure, or text a friend a picture of a mysterious rash.